Hi guys, this is Charity Stanley, and today we're going to be talking about some of the other material that's further on in care of patients with urinary problems. And so we're going to be looking at slide 23 within our PowerPoint. It should be the one that you're seeing on the screen. I'm sorry, make that 22. And so we're talking about kidney stones. And so these stones often will either be made within the kidney or they actually will progress and be within the ureter, the bladder, or even the urethra. So one of the most common things that causes kidney stones is dehydration. Kidney stones are associated with drinking a lot of soda as well, because it's increasing some of the precursors to kidney stones within the body, making it more likely for you to have a reaction like that and have pain from a kidney stone. No, stones aren't a problem unless they get stuck. You basically will pee them out and not even know. However, they often do get stuck, and it is an extremely, extremely painful condition when they do. So, things you got to worry about for risk factors for kidney stones, metabolic risk factors. People who drink a lot of soda tend to remain dehydrated because it actually has a diuretic effect. And so that's one way that it's caused. Another way is too much sodium within the diet. Um, but dehydration is the most common cause. Your urine becomes more acidic the more often you drink soda. And so when you have a blockage, all the urine that's being made gets dumped into the ureter. If that blockage is all the way across the ureter, then that pee can back up and actually cause hydronephrosis. So that's a pretty messy condition in and of itself. Guys are a lot more common to get kidney stones than females are. Has a lot to do with your race, your family history, and your in general your gene pool. So things you're going to assess for kidney stones, you're going to find out if you've had one before. If the patient has had a history of kidney stones, they come in and say, this feels just like when I had a kidney stone before, odds are they know what they're talking about. So listen to them. They often will come in screaming because they're in lots of pain too. Diet history. Find out how much water are they drinking. Is there a reason to suspect further dehydration? Find out what worked last time. Often the stones will be of the same type. Once the body makes the stones, then they continue to make the stones. So if your kidneys don't work, that is a life-threatening condition. So if there is an obstruction, you need to be on that and get it cleared quickly. Remember, it's important that your kidneys produce at least 30 milliliters an hour of urine for healthy kidneys. So things we need to do is manage pain. So they're going to be getting the good drugs with this. Expect opiates for the first 24 to 36 hours. NSAIDs should be used with caution in patients with poor kidney perfusion or who are having problems with their kidneys. NSAIDs, however, if you have a normal kidney function and this is your first kidney stone, NSAIDs are a good choice to help augment the opiates. And they also help to decrease the inflammation that is causing part of the pain. So it can be taken conjunctively. You want to make sure that you have a good amount of fluid in the body, more than you normally have, because often these happen with dehydration. But you want to make sure you're not overhydrated or underhydrated. Because if you're underhydrated, you actually are going to have to strain more to try and pee, and that's going to make it more likely that the stones will get caught in the body. Drug therapy, depending on what the stone is comprised of, we may be looking at thiazide diuretics. We may be looking at allopurinol if it's comprised of uric acid. Allopurinol can also be taken because it alters the urine pH. where sodas tend to make the urine more acidic. Allopurinol actually increases it, makes it more basic. So that helps for the stones to actually absorb. Lithotripsy, this is where we break the stone up to make it smaller to get it out easily. We often will use calcium channel blockers after a patient has lithotripsy because it slows down smooth muscle contractions. Smooth muscles line the ureters, they line the urethra, and they help to be able to get the stone out of the way of the body. Okay, so the other thing we can do is surgical management. And by doing surgical management, we either cut people open and do large incisions. That's going to be an open procedure. And so the large incisions, the open procedures are done with a patient who has a Foley in place while they're doing the operating. Then we also have minimally invasive surgeries. And so with minimally invasive surgeries, we often will go through the urethra itself to put in stents, other things like that. We want to prevent our patient from getting infected. Often the infections from the urethra or the ureters can actually get into the bloodstream and cause sepsis. So that's something we have to watch out for. And when that happens, we call it urosepsis. So often when we do UA and we diagnose urinary tract infection in a patient, we need to do a culture and sensitivity of the urine to see what antibiotic will best treat this. And often infections that are or obstructions that happen with struvite need to monitor for at least a year because it's likely to promote future infections and promote future obstructions. So with the obstruction, you need to promote about 3 liters of fluid a day. That's a lot of fluid for a person to drink to be able to help flush the stone out. So renal pain and flank pain is some of the most intense issues that the patient will complain of. Their vital signs often increase with pain. Hematuria. These stones cut into the ureters, cut into the urethra, and so often you will see blood mixed in with the urine. And as blood and other infective byproducts are present within the urine, the turbidity will increase. That's a big fancy 10-cent word that just means that it's not as clear as it used to be. And so with that, but the turbidity increase is often what you'll see when urine appears more cloudy. It's easiest to diagnose kidney stones with a CAT scan just because you're able to rule out other conditions that could masquerade and cause the pain all at once. Urethral cancer. So with this is where you have malignant tumors of the lining of the cells in the kidney, the ureters, the urinary bladder, and the urethra. So the biggest risk factor for this is people who are chronic smokers. This is commonly referred to as bladder cancer, but smoking is the most common risk factor. Often you'll see patients say that they started smoking when they were 12 or 13 and continued to smoke throughout their life, then be in their 60s and have bladder cancer. So some of the biggest things that you can do to prevent bladder cancer is stop smoking. Avoid being around any kind of chemicals that could cause problems with bladder cancer because chemical exposure is also another one of the big reasons people get bladder cancer. And as soon as you have different chemicals on your clothing, you need to shower or bathe immediately. And this will help to minimize your absorption of these chemicals. Bladder cancer tends to be very rare to individuals who are under the age of 40. Other things with bladder cancer. So you need to ask about both active and passive exposure to cigarette smoke. Find out about chemical exposure in hobbies or occupations. Are they out spraying Roundup chemicals all over a farm? That's one of the main causes of it. It also causes some lymphoma. Roundup has been found to find that as well. Ask about any changes in the urine habits or if they're having any kind of pain within the stomach. Assess the skin color, nutrition status, how well are they eating. Look at the abdominal region and be able to see if you see any masses. Sometimes you can. Examine the urine for color and clarity. So often the only sign that you'll see is blood within the urine. So cancer, anytime you get that big C diagnosis, you need to support the family and support the patient because it's a very difficult time for them as they're reevaluating many parts of their life. So how do we diagnose this? We go in and we get a bladder specimen. We do a bladder biopsy. We will run a scope up and look around to see, that's called a cystoscopy, to see if we can see a bladder tumor. We'll do a graph of this and be able to actually take a electronic picture. So this is a cystourography. We also, CT scans can help with this, ultrasounds, and MRIs. So often we use non-surgical management with bladder cancer, and we can give something called prophylactic immunity with BCG. BCG is a live virus compound. And so what we do with that, we do actual immune therapy. So we cut out the tumor. We also will potentially follow it with chemotherapy, and we will put the chemo directly into the bladder. We also may be using radiation therapy to help decrease the size of the tumor. Often that tends to be targeted radiation therapy. So specific stuff about if we're using that live virus immunotherapy using BCG, you need to have a separate toilet for the patient. They have to have this separate toilet for at least 24 hours after this live virus has been used. Men need to pee sitting down to avoid splashing. This is very similar to what we talked about with radiation precautions in thyroid disease. So single toilet for at least 24 hours. Men need to pee sitting down. After 24 hours, you need to clean that bathroom multiple times with bleach. You need to pour bleach in the toilet and flush it, and do that, repeat it at least twice. Wash any underwear in bleach and can't have any sex for 24 hours. Again, that is a live virus that can be transmitted. Surgical management. This is going to depend on how extensive the cancer is, but the main surgery for this is transurethral resection of the bladder tumor. So this is called a TURBT, transurethral. You're actually going in through the urethra, resection, cutting away of the bladder tumor. And so with this, that actually will remove the bladder tumor. And as the patient gets home, they may need to have an ostomy. So that's something that you need to be particularly aware of. Need to make sure their electrolytes are okay, because remember, electrolyte problems can cause problems with cardiac issues. And patients also often experience weight loss after this surgery as well. Okay, well, this is it for this lecture. Thank you guys for hanging in there with me. I will see you again on here soon. Thanks. Bye.